afternoon and welcome to the Unified Emergency Operations Center daily afternoon press briefing. Today we are going to hear from Milwaukee Mayor Tom Barrett. Then we'll hear from Milwaukee County Executive Chris Abele, Dr. Jeanette Kowalik, the Commissioner of the City of Milwaukee's Health Department. And then we'll hear from two guests who are with leadership team at the alternate care facility at State Farm. And that will be Deborah Standridge, who is the CEO, Celia Shaughnessy, who's the Chief Human Resources Officer. And just a note, if folks want to enable recording, please send a message to me in the chat and I will turn that on for you. Also, I am recording this call and can send a link out to everyone after the show. And when we get to questions, I'll start with questions that are in the chat window, but you don't have to put your questions there. It does help reduce the amount of crosstalk. So Mayor Barrett, would you like to get us started?
Yeah, thank you very much, Brian. Well, it's actually hard to believe that it was exactly 1 month ago today that we had our first positive case of COVID-19 in the city of Milwaukee. The county was a couple of days before, but I will always remember it because it was Friday the 13th. And we know that that number now has increased dramatically, both in Milwaukee County and the city of Milwaukee, where we're over, I think 1,700, we'll get the exact figures later, in the county, and well over 1,000, probably 1,200 here in the city of Milwaukee. And the deaths have risen during the same period. So in just 1 month, you can have an understanding now why this is considered such a serious pandemic and why our message day in, day out, has been the same, that you're safer at home and we're asking you to be at home. I do think we are beginning to see some signs of progress in the number of deaths that we're seeing, and others will talk about that today. But we also know that we are nowhere near out of the woods in terms of what we have to do to get our society and our city back to normal. And I think that is obviously the goal for every one of us, is to get back to normal as quickly as we can and to resume our jobs, resume our lives, be able to enjoy the sunshine and to get out and do the things that we love to do as Milwaukeeans and Wisconsinites. But right now, our job as citizens remains the same, to continue to do the social distancing and to do it not just for yourself, but to do it for other people that you love, people in your family, so that you don't infect them, your neighbors, your friends, and other community members. So test as a community to see whether we can do it. And as I look at where we are as a state, about 3 weeks ago, we were probably 17th in the country in terms of the number of cases that we had. We are now down to 24th. And so in a strange way, and I don't want to say misery loves company, but there have been a significant number of states that have surpassed us in the number of cases that they have. And I think a big part of that is the fact that we have been falling in those rankings is because of the social distancing that we've done. My experience has been that people have really complied with this in a very, very significant way. And I'm extremely thankful because I think it's showing results, and that's what we want to do. We want to make sure that we flatten this curve, and then we want to make sure that we are completely squashing this curve and that we will be through this and can resume life as normal. On the logistic fronts, we'll be hearing from Deborah Standridge and Celia Shaughnessy. There's a lot of progress that's been made with the alternate care facility. I want to stress this over and over and over again, that this is in essence an insurance policy, and it's an insurance policy that we never have to use. But I would much rather take the criticism that we put the money into doing this, and this is money that's coming from the federal government through FEMA, through the Army Corps of Engineers to the state. So it's coming out of the allocation that the state is receiving. And I'm very thankful to Governor Evers and his team for doing this. But what we've done, and this was something that was intentional, we wanted to make sure that there was a first-class team that was running it. And Deborah Standridge and the others that are involved in this have an extensive history in healthcare in southeastern Wisconsin. And so I have great confidence with them. The site is beginning to take shape. I think that that's very, very important. And it's moving at a very quick pace. But I hope it's never used. I hope that there are more workers that are building it out, that there will be patients who use that. If that happens, it means that we have been The flip side of that is I would much rather be in this situation than 2 weeks or 3 weeks or months from now having people say they weren't prepared. We are preparing for the worst and we are hoping for the best. And this would not be possible if it weren't for the tremendous cooperation that we are getting between communities, between the city and the county, between the city, the county, and the state. Everyone recognizes what's at stake here. And I want to thank the County Executive Abley, once again for the work that he's doing and his team is doing so that we can make sure that we're doing what we all need to do for our constituents. So with that, I'm going to turn it over to County Executive Abley. County Executive.
Well, thank you, Tom. And I know, as the mayor said, there has been some reason in looking at the numbers to think, okay, well, it looks like the number of new cases seems to be decreasing daily, but it's a short pattern. And as also as the mayor said, anytime you're seeing, we as a state are seeing any progress, the reason we are seeing progress is entirely because we're being good about the social distancing, we're staying home, and we're staying safe. And if we relax on that, we can see, and I said this before, as other communities have when they relax too soon, a resurgence, and we don't want to see that. We would love, as the mayor said, to have a brand new and empty surge facility that doesn't have to get used. But it will get used if people feel like they can relax too early. And I think that's a point you're going to hear about a bit more from other folks. And it's been great working with the city, with the state, with our congressional delegation. We have a lot of folks who agree on one thing. We want to save as many lives as possible. We want to get back to normal, get the economy started as soon as we can safely and responsibly do it. And we also want to make sure that the state gets as much of the federal support and resources that are coming out as we can. That's something we're very aligned on. And we have worked together on this. Just quickly, just an update on transit. I've given a few updates in the previous sessions. As of this morning, MCTS buses that run Monday through Fridays have resumed using a regular weekday schedule. For the past couple of weeks, we, as you may recall, had begun to a Saturday schedule, even on weekdays because volume was down. But again, we're going to go back to, as of this morning, a regular weekday schedule, which means that there'll be more frequent buses on the routes. But please note, all the freeway flyer service, U-bus service, and school trips are still suspended. And again, as I say every time, the bus is there for essential trips. We're doing absolutely everything we can to make sure that it is there and it is safe for people who have essential trips to make for essential services, jobs, or healthcare, that sort of thing. But again, should only ride the bus if you're headed to an essential job, a critical location like a hospital, a grocery store, or a pharmacy, and no leisure riding, loitering, or sleeping is permitted. That may seem like it goes without saying, but I'm just making the point to reiterate it. Again, we have maintained the cap on 10 passengers per bus. And so if there's 10 passengers on the bus and they come to your stand, they're going to keep going. And that's not to keep you late, that's to keep you safe. But the good news is the next bus should be coming soon. And obviously don't ride the bus if you test positive. And you're going to continue to enter and exit out the back door. Only unless you have help with a mobility device or ADA, and then you can be patient and our folks will work with you. And that's essentially what I've got. But, a lot of us celebrated in a very interesting and different way this past weekend, Easter and Passover recently. And, one of the things we tend to do in these holidays is we realize the commonality between all of us as a race. And we remind ourselves of the importance of compassion and love for one another. To me, the most effective way that we beat this pandemic, and we will beat it, is to think that way towards all of our fellow citizens and do everything we can to help them stay safe. And that means, for the time being, staying home and social isolation. So with that, I will turn it over. I'll turn it back to Brian, I guess. Or is it to Commissioner Kowalik?
Yep, Commissioner Kowalik.
Oh, yes, Dr. Weston's not available. Congratulations to him and his family. Thank you for the opportunity to provide an update today. Hopefully everyone that celebrates the holidays over the last week and weekend had a very pleasant time together in your homes. But we know that some people may have snuck out and spent some time with some family members. So I wanted to just highlight that as we're looking at the map and we're looking at the numbers and a potential flattening, we need more time. There's three factors that we should be paying attention to. One, looking at time as a factor in general, because you need at least a week to see a consistent pattern here. Next is looking at the election activities. So Tuesday will be the 1 week mark since the in-person election. So as the governor's office noted in the Department of Health Services, that there is additional surveillance activities that are underway to look at in-person election activities if someone is a case or a contact of a case. And then lastly, like I noted, if anyone dipped out or spent a little bit of time with other family members outside of their house, they may have been exposed to COVID-19. So, you know, just look for the next 2 weeks to see if numbers continue to flatten or if we'll see a spike. We're hoping for the best, but we also acknowledge that the election activities definitely set us back on our path. We also have received a number of questions about the order, the safer at home or shelter in place or safe at home order, what's happening with that. Right now, it's still scheduled until the end of April, and this will be evaluated closely to see if there needs to be an extension. So more to come on that. There's a lot of math going on to figure out if the projections are on par. I know the business community is itching to get back to normal, as well as many of us in our community here. We love springtime in Milwaukee and summertime in Milwaukee and all of the festivals and great things that we have in store. But we can't rush back into normal. There has to be some phased approach to make sure we are not setting us back on a path to another surge of COVID-19 infection. So another thing I want to talk about is mask wearing and face covering. So I've seen a few people violating what this should look like, and I just want to show everybody what it needs to look like, just so we can all be on the same page of what is really going to help protect you from COVID-19. Again, it's spread by droplet, which is a little bit different than airborne or aerosol, where it's more of a mist. Droplet is like a heavier, denser type of water or fluid. So I have my mask here because, you know, I like funky patterns. And this is a cloth mask. You wear it one time. After you wear it, you're supposed to wash it right away. You don't touch it, but you put it on, you know, on one ear. You don't touch the middle. And then you put it on the other ear. You make sure it's down so your nose is covered and your chin is covered. I've seen a lot of people just covering the mouth. What's the point? Or they have a beard and the beard is like just out, and that's also problematic too. This is why the CDC initially had issued guidance about mask wearing, about cutting beards. And I know that that's very difficult for some people. There may be some religious or philosophical reasons for having a beard, but the beard can also prohibit or interrupt with your ability to wear a mask or face covering properly. So I just wanted to show that to everyone because we've been getting more questions. And I'm seeing more and more pictures of people wearing face coverings and masks, but I just want to make sure we're doing it the right way. And lastly, I want to highlight where we're at. So City of Milwaukee, 1338 cases as of 2 p.m. Milwaukee County, 1773. As far as fatalities, 86 at the county level, 65 in the city. We're still seeing this disparity. Unfortunately, 63% of fatalities are African American. As far as cases, 56% are African American, 22% are white, and 15% are Latinx or Hispanic. As far as age is concerned, 33% are individuals over the age of 61, which we know is a high-risk category, as well as those with underlying health conditions. Also is looking at gender, 53% are female and 47% are male. And then lastly, when we're looking at the map of Milwaukee County, where are we seeing the most cases? And 53216 and 53215. So north side, now south side are the hot spots for cases. And then 53209 is second. for cases. So we are working and looking at other partners across the city and county to really bump up outreach in these areas to prevent the spread of COVID-19. There will be additional testing opportunities as well. That should be addressed later in the week. But again, this is all hands on deck, and we can focus more on getting back to normal if we make some sacrifices in the short term, staying at home if at all possible. If you don't have arrangements or the ability to stay at home, please call 211. The health department can help connect you to resources, whether it's a hotel room or staying at the facilities that we have set up. And then on that note, I'll transfer this over as we talk about another alternative facility that is underway. Thanks.
Thanks, Commissioner Kowalik. Next, we're going to hear from Deborah Standridge, who is the CEO of the Alternative Care Facility at State Fair Park.
Thank you, Brian, and thank you for the opportunity to be able to be part of this update to the community today. I'm Deborah Standridge. I'm the CEO of the Alternate Care Facility, and we're very busy down here at State Fair. That's exactly where we're at, in the exposition hall. You're going to probably hear some construction going on as we provide our update today. We are very humbled and honored to be part of this extension of the healthcare system in Milwaukee and southeastern Wisconsin. We are partnering with all of the healthcare systems, with FEMA, the state of Wisconsin, the county, the city of Milwaukee, the National Guard, the Army Corps of Engineers, and several other external agencies. And importantly, we're partnering with the city of West Allis as well as State Fair Park. So we're very, very grateful to all those partners who are making this alternate care facility become a reality. And I want to stress that we are an extension of the healthcare system. And what Mayor Barrett said is this facility is an insurance policy to ensure that we have adequate number of beds available for patients should the need arise. One thing that we're doing down here and that is under construction right now is creating the facility that initially will open with 530 beds. And we have the ability to go up to over 700 beds if we need to. How a patient will be admitted here is directly from the hospital, and it's a patient who is beginning to recover and is COVID positive, but is beginning to recover, and they need extra time to get their energy back, to begin to feel better. Maybe they need some additional oxygen, they need some additional IVs, but they're coming to us to spend a few days to recover while they are transitioning back to home. So that's basically what we are. We are not necessarily a hospital, but we are an extension of the hospital to help them release that pressure valve, if you will, when their bed capacity reaches a maximum. That's what we're here. We hope to open up around April 21st. That's our targeted date, so that we're adequately available to assist our hospital partners when they need us.
Thank you so much, Deborah. And next we're going to hear from Celia Shaughnessy, the Chief Human Resources Officer at the Alternative Care Facility. Celia, yep, there you go.
Yes, I apologize. I was trying to unmute, and now I have background noise.
We're getting a little feedback on you, Celia. Could you maybe for one more time for us, please?
Yes. If you, for one moment, I'll switch to where I'm standing.
Okay.
You probably have the sound on both your phone and your computer. You only need one.
Yes, I don't have my phone on.
Oh, there you go.
So I apologize for that.
Oh, there, that was easy. There you just.
Yeah,
over into the
sometimes
next
musical
window.
chairs
Fantastic.
works well.
Brilliant.
So I'm Celia Shaughnessy, Chief Human Resources Officer for the Alternate Care Facility, and I second Deb's statement. It's an honor to be here. I'm also proud to be part of the Wisconsin and Milwaukee community, as through word of mouth, people have expressed interest in helping in any way they can from a staffing perspective. So that is shows that we are that our state and city counties have. So I just want to say that we are at a very critical point in recruiting. We'd like to start our initial orientation on Monday, the 20th. So that is 1 week from now. So we are seeking interested healthcare professionals that are looking to support us. And these are both paid and volunteer positions. So I just want to emphasize that there's opportunities for both. So the best way to do this is to go to the Wisconsin Emergency Assistance Volunteer Registry, and that's short for Weaver, WEAR. And you will be able to see where there's the best opportunity to sign up specific to the Milwaukee alternate care site. We're looking for both active and retired healthcare professionals and staff. And if you enter your information into this website, it is secure, it's password protected, and it's a web-based registration system that enables my team to very quickly identify you, give you a call, and hope to recruit and onboard you within the next week. Now, with that said, we anticipate that this is ongoing recruiting, given the numbers of staff and professionals that we need to recruit for this facility. Our goal is for Monday to at least be able to staff for the first 100 beds, and then Tuesday continuing to orient as people show interest. And just to be very clear, our staff and professionals here are not intended to place existing healthcare facilities nor pull essential staff from area hospitals. So that's very important. As Mayor Barrett said, this is our insurance policy. We want to make sure that our hospitals and isolation centers are adequately staffed. So we are here to support the existing healthcare facility delivery system. If you are interested and currently employed at one of our local healthcare sites, please check with your employer before applying to help at the alternate care facility. And I just want to emphasize, we're looking for roles like physicians, internal medicine, family practice, emergency medicine, nurse practitioners, physician assistants, ED techs, medical assistants, pharmacists. It is important that we have some nursing leaders that support our, along the course, our nurses. So if any interested leaders, as well as our RNs, we are looking for you to come on board as quickly as you can. So I will start.
Okay, thank you so much, Celia. So just a note for folks who may be used to seeing Dr. Ben Weston on this call. He was referenced earlier. His wife had a baby yesterday, and so our congratulations.
A round of applause.
Round of applause for Dr. Weston.
And his wife and baby.
And his wife and baby. Unfortunately, I don't have the specs on that baby for you, but
She's beautiful, I think. I think she's
healthy and doing well.
beautiful. That's what I heard.
So for those wondering why Dr. Weston is not here today and might not be around for a few days. We're going to move on to questions now. And I just want to also ask folks, thank you so much for putting your questions in the chat. If you could please also identify the media outlet you're with. We do need to step up security a little bit due to recent events and dealing with Zoom calls. And so just, for everyone's security, I want to ask folks to let me know who you're representing, what media outlet. So the first question I have is from Derek Rose at WISN. His question is for the mayor and the county executive. Have either of you become aware of any city or county departments requesting PPE from any provider or supplier, and those requests or shipments have instead been taken or intercepted by the federal government? If so, which departments and what are your next steps?
I can say for the county, that's not something specifically that we've seen. We've sort of centralized procurement to try and organize everybody so we're not kind of competing with each other and we can make it efficient, but that's not something I'm specifically aware of. I don't know, Mr. Mayor, if you've had that.
I think a number of days ago, I think that the police department was interested in something, was working with their purchasing department, and they thought everything was moving along very swimmingly, and all of a sudden it was gone. I don't know that it went to the federal government or where it went to. I think this shows what happens when you have the lack of a coordinated effort nationally is, and you've seen this in the national press, that there certainly is a survival of the fittest out there, where unfortunately states and even municipal departments are having to compete against each other. I'll also say that we remain in need. Our fire department, our police department, our Department of Public Works all need PPE equipment. Certainly the gloves, I think the masks are in strong demand, but there are others, I think, as well. I think this is a situation where we clearly have to increase the supply, because as more and more people are wearing masks in public, as they should, it's going to put more pressure on local units of government to be able to maintain their supply. But I would say even in grocery stores and service workers, they're all going to need more. And so this is a time where I'm hoping that there are still private entities who can step up and provide some of this locally, because I think that that actually is our best chance. So I know Friday when I was looking, I saw that the national stockpile was almost depleted, and I don't know if it's replenished itself, but I think that shows you the challenges we have in trying to rely on the federal government. I don't think that we can really just sit back and think that the federal government's going to get this for us, because that's not been the case up to now.
Thank you. Derek, since you already had one question, I'm going to come back to your second question and give other folks a chance to get one in first. So next question I have is from Rebecca Clough. And Rebecca asks, for Mayor Barrett or County Executive Abley, could you comment on the federal class action lawsuit that has been filed by Milwaukee area voters calling on a partial or full revote of the April 7th election?
I have not seen that, so I cannot comment on it. I have not seen that lawsuit.
Right, nor have I.
Okay. Next question is from Susan Bentz with WUWM. Can you provide more information on increased testing that Commissioner Kowalik said will be stepped up later this week?
So we've been working on increasing our capacity, at least the public health labs, and then of course the other providers in the area. So getting the message out to healthcare providers that there's additional capacity, so send us your specimens so we can run them, is very important. We understand that many healthcare providers have relationships with various labs. It's a contractual relationship, so they can't necessarily just deviate and send them to us. But for those that can, we are able to process samples. And if you're able to do it in state, you're going to get your results much more quickly than having your labs or specimens sent out of state. We know that has been a challenge for many people in our community, having to wait a week or 2 weeks to find out if they're positive for COVID-19. So the sooner we can get samples back, the better. Now, as far as other points of testing or having like these community testing opportunities or drive-up testing, those things are in the works. So I'll be back on Friday. So hopefully there'll be an update between now and Friday on additional testing opportunities and providing information on screening and testing in a concise manner. We've received many requests about that. So we want to make sure we're being responsive and meeting the needs of the community.
Next question for Commissioner Kowalik from Ashley Lutheran at the Milwaukee Journal-Sentinel. Could you take us through the contact tracing process and the time frame for that process? And how many city health workers are currently assigned to doing contact tracing, and how many state health workers are assisting them in the city? She references a previous update that mentioned 100 state health workers would be assisting in the Milwaukee area.
Right. So the state has been working on providing additional support for the surge of cases. Obviously, Milwaukee County, City of Milwaukee has had the most cases. So these contact tracing exercises can be very time intensive. So let me just break this down first, because I keep receiving questions about contact tracing, but that's only one element of an investigation. So as a public health professional, what happens is, the person goes to their provider, they get a specimen or give a specimen, that specimen is processed in the lab. And then once we find out that person is positive, that information is transferred from the lab to the health department where that person resides. So sometimes we get like questions about lab results, but they didn't come to the city of Milwaukee because the person might live in Waukesha, for instance. So that would go to Waukesha's public health department. So once the health department receives it, that's when a clock starts ticking. That's when the public health staff conduct a case investigation. So the case investigation is finding out where all this person has been, what did they do, who do they consider close contacts, who has spent under 10 or more than 10 minutes, less than 6 feet apart to this person. Maybe it's someone that lives with this individual. It could be someone that they worked with, whatever. So nonetheless, there's different levels of exposure. So the close contacts, of course, are those that you're most concerned about. Then you have like medium or intermediate levels of risk, people that were kind of close to that distance and time aspect. And then you have low risk contacts. So someone that maybe was at the same event as the person, but they didn't necessarily interact with them in that time frame or in that distance. So the health department then moves into this contact tracing element where you're reaching out and finding all of these people, which you can imagine can be extremely time consuming and take a long time because you have to find all of these people. It's like a disease detective, if you will. Matter of fact, that's what New York Health Department calls their people, disease detectives. So you're tracking all of these people, notifying them that they may have been exposed, and you're educating them about the symptoms of the disease. So symptoms of COVID-19, sore throat, muscle aches, respiratory issues, fever, chills, now this loss of taste and smell, GI issues, and this cough. So you're educating them to keep track over the next 14 days from whenever they were exposed of these symptoms. And if they start to develop the symptoms or worsen, they're supposed to contact or notify the health department right away. Then they move into testing depending on their level of risk of having complications or death from COVID-19. So if they have underlying health conditions or if they're over the age of 60. We also are looking at where people live. So I noted these 3 zip codes, 53216, 53215, and then 53209. Definitely areas to be more concerned about. The state hasn't added zip codes as a criteria for testing or like a priority for testing yet, but this is something that I think would be really helpful for us to be able to move more quickly in these areas. So normally the health department handles the entire investigation and contact tracing. But as you can imagine, some people have many contacts. So say they went to a certain event and they may have had exposure to like 100 people. So you have to contact all of these people. The last time I checked, our average for contacts is 5 people, which isn't too bad. But the state provided assistance in the method of bringing additional folks in to do the contact tracing element. So the health department was doing the initial case investigation, identifying the contacts, and then the state was following up with all of these contacts. As far as staffing is concerned, my latest numbers is 20. So we brought back several retired public health nurses. So we're very grateful for them coming out of retirement to help us in this great time of need. And then our existing health department staff. So either reassigning staff to our communicable disease unit, and then of course the folks that work in that unit providing assistance. And I also want to shout out the other health departments in Milwaukee County that have been offering assistance throughout this great time of need. There's been great support from the other jurisdictions. There's 11 of us in total, but whenever we're short or we need additional assistance, they offer to fill the gaps. So we've been working as a county on the public health investigation side, and then the state was assisting with the contact tracing. But that looks like there's going to be some changes in that, because now that they have these additional people on board, what does that mean? So there'll be more updates on that whole process, but I just wanted to give you a sense of terminology in public health, how long this takes, all of the steps in the process, and then what is normal for us, again, looking at average of 5 contacts at this point in time. Thanks for asking the question.
Thank you, Commissioner Kowalik. Next question I have is from Sean Kirkby with the Wisconsin Health News, and he asks, what is the budget for hiring healthcare workers at the alternative care facility, and who is providing the money for the staffing?
Ryan,
Fortunately,
I can help answer on Deb's behalf. The funding is coming from FEMA, and we're working with the state to make sure it's a smooth process.
okay, thank you.
The state's been very good in all this, just so people are aware of that. The state's really stepped up on this, and we really appreciate it.
Thank you. Next question I have is from Ashley Sears with Fox 6, who asks, how many volunteers/employees would be needed at the alternative care facility, and what sort of jobs would the volunteers be doing?
Sure, thank you. Great question. We need hundreds, honestly, of workers per week, even as we're filling for the first 100 beds. And obviously, we'd like to staff for the plus 500. So we would take volunteers for any of the positions, frankly. I did say that, of course, there are paid positions available, particularly for our patient care staff, but we do have positions like patient registrar, discharge, runners. There's a number of positions outside of the actual facility part that we need help from an administrative perspective. So even from a human resources perspective, there's lots of retired individuals. We'll be running orientation twice a day, 7 a.m., 7 p.m. And so there's always assistance for people that have the administrative skills as well. Great question.
Thank you. The next question I have is from, I believe it's pronounced Sharon Bagenda. I hope I got that right, from CBS, who asks, this is for Deborah, could you talk about the licensure process for retired healthcare workers who are waiting to get back to work at the alternative care facility? Are the licensure processes more relaxed?
Yes. This is Celia. We're just to make sure we're having microphone issues. The answer is yes, they are more relaxed. There are very specific, I'll call it regulations, even though relaxed. So that is something that we would, as soon as someone puts their information into Weaver, we would contact them and talk to them about those relaxed criteria. But that's why we're encouraging people that are not licensed currently to contact us.
And one sort of point of clarity that I forgot to include, they're also curious, is would you describe that as an expedited process? Is there any expedited process for?
Yes, it will be. Absolutely.
Yeah. Okay, thank you. Okay, and I'm going to jump back to the second question that I had from Derek Rose at WISN, which is for the mayor and county executive. And he asks, given what we saw last week with the Potawatomi Hotel and Casino having to furlough its employees, are there discussions or plans to furlough city and county employees?
I can jump in first. I mean, it won't shock anybody that the county, like every government right now, has had significant detrimental impact on our budget. We've been forecasting for some time, actually, a reevaluation of the rest of this year's budget and next year. But because, like the city and the state, we're all very dependent in terms of our revenue on the economy, and the economy's slowed down, we're going to have a lot less to work with. We've taken quite a few measures already at the county. I can tell you this, we're going to do everything we can to preserve essential services as much as possible, and balance that with preserving whatever jobs we can. But I like to think I'm a good manager, but I'm not a magician. And when you have to start out a year with a massively larger hole in your budget than you had the year before, you can't do everything you could before. So, looking at everything, not doing that yet, but, people should expect that from probably most levels of government.
And at the city, the vast majority of property tax dollars are going towards police protection, fire protection, Department of Public Works. So a lot of them are very, very essential services. Then we've got libraries, we've got the public health, the health department, which I think people recognize right now it needs more dollars rather than fewer dollars. So we are evaluating not only what our revenues are, we're evaluating what our spending is to see how much of our increased spending, because we're seeing some significant increases in spending, again, particularly in the health department, which we believe will be compensated through the federal dollars. And then we're continuing to do almost on a daily basis an analysis of where we go from here. So it's very much something we're monitoring very, very, very closely, but obviously we haven't made any announcements up to this point.
Thank you. Next question I have is from independent journalist Jacqueline Ward, who asks, are there higher rates of CV-19 for nursing homes or public housing and jails?
And we have evaluated that. I've responded to this question before the change in testing criteria, so we need to evaluate it again. But the last time I checked, we didn't see it to be at an alarming rate or anything like that. But we will evaluate it again. I know I have received a number of queries about long-term care facilities that aren't necessarily in the city of Milwaukee, but just people that are concerned about their loved ones and, you know, what's going on and not getting up-to-date information from the long-term care facilities. So again, those are regulated by the state, and we do refer any complaints to the state so that they can follow up on those complaints.
Thank you. Next question I had also from Ms. Ward. This is another question related to messaging to underserved communities as it relates to mental health, homelessness, youth, and disabled. Regarding the funds from the Medical College of Wisconsin for messaging, I believe we discussed that on Friday when Dr. Ehrenfeld from Advancing a Healthier Wisconsin announced a $500,000 grant for culturally appropriate messaging. Does anyone, can anyone answer how the process for implementing those resources for that purpose for messaging?
So each of our grant projects has specific partners as well as any consultants that are being brought on board to assist with marketing for various segments of our community to be precise and meet the needs of our community. You know, what is going to work in the Hmong community is not going to work in the Black community. So, and then within the Black community, there needs to be very specific marketing for all of the groups within the Black community. So marketing firms that know how to do that, that are going to get that information out, knowing that we can't do a full campaign with audience testing like we normally would when we're looking at public information campaigns and health promotion campaigns. We have a short amount of time, so we have to be nimble and flexible about getting the messages out. But my response again would be that any partners already identified in these grants, there's different ones, not just the one with the health department. For instance, there's another project that's looking at seniors and doing specific outreach to seniors. So I would recommend looking at the Advancing Healthier Wisconsin website to see who all was funded and who is the project lead for those, and then contacting them directly if you would like to get engaged, if possible.
Thank you, Commissioner Kowalik. And last question I have is, I'm not sure who this is for, again from Ms. Ward. Is there any collaboration or connection with the Red Cross as it relates to volunteers? I guess this would be for either of the folks from the alternative care facility.
Brian, I'll answer that. We're continuing to expand our partnerships with a variety of agencies. We're working right now directly with the United Way, and we'll continue to expand partnerships and look at the Red Cross and others as we develop the roster of needed volunteers and staff.
Thank you so much. So that's all I have for questions. I want to extend a thank you again to our guests from the Alternative Care Facility, Deborah Standridge, the CEO, and Celia Shaughnessy, the Chief Human Resources Officer. And with that, we will leave it there for today, and we will be back tomorrow. Thank you.
Thank you.
Thank you all very much.